All right, this is patient 2. Background, we have 83-year-old that was admitted to a skilled nursing facility. They are experiencing chief complaints of a dull stomach pain that comes and goes for 1 month. The pain is worse when the patient does not eat, and it's better when the patient eats. No crazy significant history except PAD, the peripheral arterial disease. Medications that they do take is aspirin on the daily to quote unquote help with their arteries. Patient denies lower extremity edema but decreased sensation to the feet. Vitals are all within normal limits. No temperature, 97.5, 97% oxygen, 16 respirations, heart rate is 66, and 116/84. Looks better than my vitals. Hi, my name is Victoria. I'm performing hand hygiene, and I am putting on a new set of gloves. I'm going to be your nurse for today. So I was kind of reading over your chart, and I saw that you're complaining of dull stomach pain that comes and goes for about a month.
Yeah.
And it's worse when you don't eat, and it's better when you eat. Is that correct?
Yeah.
Okay, and then also you were complaining of some decreased sensation in your feet, but you haven't noticed any swelling. Is that correct?
Correct.
Okay. So for today, just kind of a little education. If you're in any pain at any point during my assessment, if you're in pain, just let me know and we can take a break, and I will walk you through what we're doing. And if you have any questions, just let me know and I can better explain it to you. So 2 things that we're going to be doing a focus assessment on is going to be abdominal assessment and a vascular assessment. The vascular, again, because you were having decreased sensitivity, and the abdominal pain because you've been having the belly issues for about a month. Some education beforehand. I do see that you're taking aspirin daily, which is good because you're medication compliant, but especially with your age of being 83, you are at increased risk of GI bleed and stomach irritation, heartburn, and ulcers from the aspirin. So those are possible side effects, and I'm not sure if the provider went over those with you when you first became on the medications. So with the symptoms of worsening pain when you don't eat and better when you do eat for about a month, you can possibly have PUD or any type of belly ulcers, because those are those symptoms that you get. But we'll go ahead and make sure nothing else is going on. So if that's okay with you, I'll go ahead. We're going to do a few different things for the abdominal assessment. Patient is supposed to be supine, but we're not going to lay flat, so we're just going to pretend you're in supine. If you can lean back a little bit for me. All right, so again, I'm going to walk you through the assessment. I'm going to go ahead and inspect your abdomen, look for any type of scars, any type of distension, a rigid belly, the skin color, everything looks up good. We're going to go ahead and lift up the shirt and everything looks good. If that's okay with you, I am going to auscultate, which is listen to your bowel sounds, if that's okay.
Yeah.
So I'm going to take my stethoscope, and there's 4 quadrants in our belly, so I'm going to go ahead and listen. You can just breathe normal, okay? Good. It sounds like you just ate. Did you just eat? You got nice, good, active bowel sounds. In the 4 quadrants, we were checking to see if you had hypobowel sounds, which is low bowel noises. Hyper is kind of overactive, more than 30 within a minute, but you have good, nice, active bowel sounds. Again, if you can go ahead and stay laying flat, I'm going to go ahead and percuss your abdomen. We're going to check for tympany and dullness within the abdomen. We're going to kind of check in 12 different spots all through your quadrants of your abdomen. I'm going to use my middle finger, the distal. Good. The dullness noises, just to kind of educate you, means that there's solid organs, and tympany is kind of like a drum noise, drum sound like noise. That's more so in your intestines where all the air is. So I did hear both of those, which is good. Have you been having increased gas?
No.
No. Are you regular with your bowel movements?
Yes.
Okay, when was your last bowel movement?
Yesterday.
Okay, but no diarrhea, no
No diarrhea,
issues with
no.
constipation. Okay. So next is we're gonna palpate. For this purpose, he's laying supine still. I'm gonna lightly press on your abdomen and then deep press on your abdomen. If you're in any pain, please let me know, okay?
Okay.
The first quadrant, we're light palpating. And I'm going to go ahead and do a deep palpation. Alright, and I'm also palpating for epigastric tenderness. Any tenderness when I was doing that?
No.
Okay. So that all went well. We were making sure there was no swelling, no masses, no rigidness. All of that kind of helps determine what's going on inside of your stomach. I'll go ahead and let the provider know. Your appetite's been okay? You're eating 3 meals a day?
Yes.
Okay. The second assessment is going to be the vascular assessment. We're doing this because you have a history of peripheral arterial disease and you are having decreased sensation in the feet, so we need to check the vascular status and circulation. So first and foremost, I'm going to go ahead and assess by inspection. So we're looking, making sure there's no hair loss, no ulcers present. Can you lift up your feet for me? Good. The skin's intact, the color looks good, the skin integrity is good, and there's no edema or anything like that. The next, we're going to go ahead and palpate. So again, I'm feeling any pain when I squeeze?
No.
No? Okay. I'm assessing the pedal pulses. Good. Good. I'm looking behind. Good. Good. The temperature of the skin feels normal. Skin turgor is normal. There's no signs of dehydration. In terms of sensation, and I'm gonna look cap refill similar to what we did to your fingers in another assessment. I'm just gonna squeeze. Good. I'm just checking for blood flow and nerve function during this type of assessment. In terms of squeezing, are you able to feel?
Yes.
Okay, how about the other side?
Yeah.
Okay. If that's okay with you, I'm going to support your heel. And we are going to measure the sensation for neuropathy, so it's a neuropathy test. So I'm going to poke the bottom of your foot. Keep your eyes closed. Can you feel?
Yeah.
Can you feel?
Yes. Yes.
Okay, I'm going to do the same with the top of your foot. Alright, good. Let's move on to your right foot. Keep your eyes closed for me. I'm supporting your ankle. You feel?
Yes.
Okay. And the top of your foot. Okay, you can move on. What we did right now can help detect us from early changes, in especially since you have a history of PAD. I'll go ahead and let the provider know. And again, just keep up with what you're doing. Nothing really stood out in terms of masses and stuff. And that's the end of the scenario.